So my name's Efua and I am a qualified operating department practitioner. And so my day-to-day, normal days, if I'm working in theatres, we cover anaesthetics, surgical and post-anaesthesia care. And so my favourite area is post-anaesthesia care because I find it a bit more challenging because there's no doctors around as well. But I'll give you a quick run through about what we do. So if we're working in anaesthetics, you will greet the patient, and obviously coming to surgery, whether it's local surgery, general anaesthetic, or any sort of regional, is quite nerve-wracking because you don't know what's going to happen, who you're going to meet as well. So it's introducing yourself, working with your anaesthetist, it's getting all the drugs prepared as well, making sure we've got the pain drugs available because those are the main things that patients are worried about as well. Checking all our equipment, making sure we've got all the airways available as well, and working with the surgical team. So we're working on the surgical side and then sort of working with our surgeons, and also we also work with other members. We don't just one person working with a surgeon. We've got a couple of individuals and we have some circulators as well. So we'll be checking our sets, making sure we've got the correct equipment, all the supplementary things that we might need, like suction. We may need some implants if you're, say, coming for a hip replacement, for instance, making sure we've got the correct size because we've got different anatomy as well. So making sure we've got the correct size and the correct type and the correct size as well, because it's part of our checklist that we do as well. And a lot of the time, all the time that we're looking after our patients, we are constantly checking. So it's not just the name, the date of birth, we're checking the consent form. Do we have the right equipment? Do we have the right personnel? Have we got x-ray available? So we're looking at all those things before we actually start. Then we do a proper stop, a guided stop, and then we'll then check again before we move on as well. And just before we close the wound, we will then do another stop, and then we'll check to make sure we've got all the instruments, all the swabs, we've got all the needles, everything is all accounted for as well, because anything missing, we do not like things that are missing as well. So once the procedure is done, and then the patient will be taken to post-anaesthetic care, and so that's my favourite bit because there's no medics. So what you've got to do, you've got to look at what the patient's come in with, what procedure they've come in with, looking at their past medical history as well, looking at the drugs that have been prescribed, and just looking at the general condition of the patient. So we're there to make sure that you are, I call it the first stage of recovery. So you're not fully recovered, you're not going to be able to bounce up on a trampoline, but we're looking at your airway. Are you able to speak? Are you able to have sips of water? What is your pain like? You're not going to be completely pain-free, but it's how we can make you as comfortable as possible. How is your sickness? Like you can feel a bit sick because you may have been starved for a while as well. Positioning, if you need any additional sort of pain relief, we will then look at what has been prescribed, and then we'll then administer as needed. If there's anything, say for instance, we need to do a repeat x-ray. If you've had a central line, we'll make sure that's done in recovery before you go to the ward, because we need to make sure positioning is okay. Also, the patients, it's quite funny because sometimes the patient will ask you a question and you give an answer, and then 5 minutes later they'll ask you the same question and you give an answer. Because when you've had anaesthesia, sometimes your memory, it takes quite a while for you to come back as well. So we're also looking at memory and just ensuring that the memory loss is kind of what we're expecting, but not sort of the long term, and doing a lot of the documentation. And also if we're looking after paediatrics, because I used to do a lot of paediatric work, it's having the parents or carer coming to the space as well, and also reassuring them that we're doing the best that we can, because they're the best lookout for us as well. So we're working not just with our clinical colleagues, we're also working with our patient and carer colleagues as well, just to make sure they get the best care available. So the type of patients that we see, I mean, personally in my career, I've seen everybody and anyone. So patients from the age of like 24 weeks delivery, all the way up until like 100, and I think this one was 101-year-old. So I've done a wide spectrum of patients as well, coming from so many different surgeries. So whether it's something like a horrible splinter or an abscess on a finger, all the way to transplant. So I've seen the whole sort of spectrum, and having worked in a trauma centre, you can imagine some of the traumas that we may see, whether it's road traffic accident, horrible stabbing incidents. Those traumas, I've seen everything as well. And actually each patient comes with the same core things. They're scared. So our jobs as ODPs, working with our nursing colleagues and our doctor medics as well, is to try and do what we can to alleviate those anxieties, to plan as well for them and do what we can to help them. Because when you're in that stage, you're so vulnerable. So our job is to make sure that we're looking after you. If somebody's coming with a carer or a partner, it doesn't matter what age, whether you are a paediatric patient or somebody my age or even older, you've got people around you. So if they're coming with an escort, you're then reassuring them that we're going to do the best that we can to look after you as well. In terms of working with other allied health professionals, yeah, so I worked mainly with those like physios. If we've got a patient that is with cystic fibrosis, we'd book a physio in and they would come and do some physiotherapy whilst the patient was under anaesthesia, and it makes it so much easier to do the therapy as well because they're under anaesthesia. All the horrible stuff, it's a bit looser, so it's easy to suction. Dietitians, if we're doing bariatric surgery, which I used to do in my previous post, you would work with your dietetics team as well. So what do we do post anaesthetic wise for them? So that means you're able to start those conversations pre-assessment and also post anaesthesia care. So you're kind of linking in that care. Also working with your OTs for like movement. I remember like personally having surgery and having to have an OT sort of do an assessment, like working on the stairs, how are you fixed in your house. So you're working with our allied health professionals to gain that knowledge to also help with your patient care subsequently as well. Where I trained at Lewisham, we did a lot of ENT surgery, so audiology, so we worked with our audiologists, and it was fascinating when they're coming for surgery for certain ear sort of ear operations, and how the audiologists will work with the surgical team to ensure that the patients then have, you know, the best outcome that they can for them later on as well. So those are my main sort of link in with other allied health professionals as well.